And welcome back to Matrix Breakers. We're going to get over on the discussion about RFK Jr. and what he's looking to do, in my opinion, which would be more importantly, to expand the wellness industry and to make America healthy again, right? I would argue we were probably healthy like 100 years ago. But then you've got to look at all these other, life expectancies and different things. I think that ultimately, before we get into this discussion, I would love to address the idea of the redemption arc. Okay. If you study history, you will recognize that there are people who are imperfect people who have had potentially horrible histories, a horrible past, have done bad things, and they are redeemed, and then they go on to do good things. Happens all the fucking time throughout history. And so the reason I bring that up is if you look at the Bible, the redemption arc is real, right? You look at King David, Solomon, right? You look at there's so many different ones, just characters I'm thinking about that are biblical, that you almost Saul, of Tarsus, and it turns to Paul, right? He was a killer of Christians. I mean, that's a redemption arc, right? And then he goes into be one of the, greatest disciples of Jesus. There's so many. I just can't even throughout the Bible itself. And you think of these redemption arcs and these people who have a past and then they turn things around for the better and then go and create a great life, or even lead great movements and make great change. I give you another more recent history example is Martin Luther King Jr. The FBI essentially was able to blackmail him by tracking down his past with women and the fact that he was a womanizer, right? So they wanted to use that as a demonization campaign in the media, right? And we do know that the FBI was involved in the assassination of MLK, which I hope that we can get revealed those documents as well. JFK was also a womanizer, okay? This is RFK Jr.'s uncle, who was president. I mean, the guy would bring in women to the White House and have sex with them while he was married. That happened all the time. And that was his addiction. That was his issue, right? And so I guess I bring up the point. You think of all the things that JFK did in his life, and there are no perfect people. And what we're experiencing now is historically, you could see it as a redemption curve for various individuals. Look at the top three people I'm thinking about: Trump, Elon Musk, and RFK Jr. We're going to get into RFK Jr.'s policies in a moment. But I just wanted to clarify, these are imperfect people who have very checkered pasts, have said ridiculous, scandalous things, have been involved with scandalous things. And I see that because I saw this criticism of RFK Jr. Oh, he was an addict. So therefore, it's like small minds gossip about people and they only see their past. And that's a really toxic trait, just so you understand. Like, if I were to do that, which I refrain from doing that because I have seen so many great changes happen within people, whether it's someone who has been to prison and then they get out and they're like walking with God and they're an amazing person. Like, why would you criticize that person doing great work? Even we could even say God's work because of their time in prison or what they did prior to prison or something. It's just a weird conversation to have, and nobody's perfect and you're not perfect. And so if you think like that, then you're really just a small-minded individual who is more of a critic than an optimist and doesn't really actually see the human experiment as an appropriate, very non-linear, compassionate, very conscious level of existing, right? Like it's a very, we make mistakes every single day. We even fail every single day. So I just think to label these criticisms by always talking about the past is just not necessarily the most accurate depiction of what is the potential for some particular person. So I just wanted to start by saying that it's so obvious that that's true. Everyone knows it, but some people just like to selectively criticize individuals because of their past and want to bring that up as if they have nothing to contribute to the future of humanity or whatever they're doing now. And so just wanted to start the conversation by saying that. I think it's important to recognize, if you're being real, let's look at what happens. Like, let's be an observer of history, because we're living through history right now. Whether you agree with what's going on or not, you're living through a very historical time period. And people will look back on this history and realize all of the things that happened, right? And I think to get into RFK Jr., like, he's clearly said some very important things. He has brought up very significant highlights to medicine in general and health in America. And let's go over it. I wrote some notes here. I'm going to reflect on these notes. How is the wellness industry going to expand and grow through RFK Jr.'s policies? Let's have a real discussion as adults as to how that's going to happen. Number one is the transparency in health. I'm going to read what I wrote. RFK Jr. has pledged to usher in an era of radical transparency within HHS. This initiative aims to make data and policy processes accessible to the public, reducing the need for FOIA requests, and enhancing public trust in health agencies. FOIA requests, it's like a legal way to try to access information the government has. By demystifying how health policies are made, this could lead to more informed public health decisions and foster greater public engagement in health matters. Transparency. So, a lot of the time, these NIH studies and FDA studies of various different medicines and food groups and things are classified or just never released to the public, and it's just shady, right? That's the problem, is these studies are done and they're filed, and they might show a less than positive outcome for a particular medicine. But then what happens is the FDA approves it anyways, as if to say, oh, we've done the research and we're going to approve it, while not disclosing the research on a particular medicine or a product. It's a little bit odd. You don't want to do that, because then when people start to consume that product, and maybe, let's say, something happens to them, or there's an oddity that occurs, then people are like, well, we're going to sue the company for this reason, and I took this product and this is what happened. It's a negative result. And then to just claw the research from NIH is just a horrible hassle. And so I think by creating transparency, people are going to be more informed and be able to make better decisions for their health, because they're going to be like, oh, well, this study has shown that product actually doesn't work long term. Or this study from the NIH showed that this product only works for 6 weeks and then it stops working. Like, there's so many different layers to the importance of access to information like this that comes to an individual. And again, how does that expand the health and wellness industry? The wellness industry, which is more natural remedies and things like that, how does that grow? Well, I mean, if people are questioning the studies that are happening of traditional medicine, and not even traditional, it's actually modern medicine, that's the right way to say it, then they can at least look to the alternatives, right? And be like, well, maybe I could use these natural alternatives first before going into this sort of haphazard option, right? And I think that transparency will lead to people going into more of a wellness route. And again, this is going to grow because there's a lot of people who are in the wellness industry, and whether you're selling some kind of a supplement, or whether you're selling some kind of a coaching program or whatever have you, or just like a diet and nutrition program, there's so many different things you could be doing that are enhancing people's lives, doing it naturally or seeking natural remedies and alternatives to what we know of as modern medicine. And so with the transparency, I think that you can have more of that. What's another thing that he's doing? Well, combating the chronic disease epidemic. I'm going to read here. One of his primary focuses is to address the rising tide of chronic disease in America. His Make America Healthy Again platform emphasizes preventative measures, such as improving diet quality by regulating food additives, reducing the prevalence of ultra processed foods, and advocating for cleaner, less chemical laden food products. This approach could significantly reduce the burden of disease like obesity, diabetes, and heart disease, potentially lowering healthcare costs and improving quality of life. So, while we address these food problems, I think that it's a dual wield sword. So you can't just go in and say, okay, all Monsanto products are no longer allowed on the shelves in grocery stores. While in the aggregate, that might be a great idea because these are poisons that people are eating and they're probably causing cancer, right? Um, I think his approach would have to be a mix. You can't just ban that because that has become such a large portion of market share in the industry of agriculture and farm products that it would be very difficult to try to eliminate it completely. So it's this mix of needing to inform the public that these products and these foods are bad for them while allowing the alternative to occur, which is people maybe buying a natural source of the same product or even going to their own farmer's market and seeking those kinds of, foods and alternatives there. So it's a mix. You can't just delete one thing because there's not enough of the other. And what I think is going to happen is people will slowly like wean off of this, these food additives that are inside of Oreos and Twizzlers and whatever the fuck you find at the grocery store. And then they'll slowly be informed about it because there's a lot of normies out there that don't actually know anything. They don't know that this red 40 dye is bad for them or is cancer causing or could be just toxic in general. A lot of people still buy canola oil every single day. They have no idea that it's bad for them. So there's a number of that you can have. And so while getting people to, let's say, replace canola oil with grass-fed butter, that market has to respond appropriately. So therefore, the demand for the canola oil and the seed oils and the shit can go down while the demand for the natural things like butter and tallow can go up, right? And so there's a natural reoccurrence there. And so I think that when it comes to addressing this, it's like you look at the food that people are eating, you look at the products that people are taking, and you have to demystify this so that people can make accurate decisions for themselves. So the other part here is to reform in food safety and nutrition. So Kennedy's interest in rethinking the U.S. food system might lead to tighter regulation of food dyes, sugars, and other additives. His push against the industrial food complex could result in more stringent food safety standards, possibly leading to safer, healthier food options in schools, hospitals, and public cafeterias, which would benefit public health, particularly among children and vulnerable populations. Super, super important. I was sort of addressing it there. But as you start to look at the studies that show the effects of these various chemicals in our food, less and less companies on a larger scale are going to be ordering those foods. So whether it starts with small restaurants no longer ordering in bulk from a particular food company that RFK Jr. has then used the NIH to study or the FDA to study as labeling them like, hey, this is a bad product. This has preservatives in it. This has additives in it. This has red dye in it. This has problems, toxicity. It may curb other restaurants and other grocery stores from ordering those products, which again decreases the demand in those products and therefore the supply in the marketplace, and then increasing better alternatives. So again, regulating the food safety is going to be important. Holistic and preventative health approaches. By proposing to dedicate more NIH research funding towards preventative, alternative, and holistic health approaches, he aims to broaden the scope of medical research. This could lead to breakthroughs in understanding how lifestyle, environment, and natural remedies can complement traditional medicine, potentially offering new avenues for treating chronic conditions without solely relying on pharmaceutical intervention. So this is massive. So for the wellness industry, it's probably the number one biggest stars in the sky point that's going to be brought during his term as HHS. So with the focus on allowing alternative holistic approaches, the NIH essentially is a gatekeeper, right? They have government funded money to do studies. If you're a wellness company right now and you're a supplement company or you are a natural product company of some kind, you have to pay out of your own pocket for studies to be done of, let's just say, the benefits of turmeric on inflammation. Just giving you an example. You're paying out of pocket for that study. And that goes into the costs of your product and how you deliver that product to the marketplace. So when that cost, it's a barrier, right? Because you're like, oh man, I have to study this to create a claim that this turmeric product you're making can help you reduce inflammation. And then you have this whole thing, oh, well, this is not FDA approved. It's just this gatekeeping shit that's been going on that protects modern broken medicine, I could say, pharmaceuticals, chemicals, right? Protects this horrible chemical laden product industry, and then makes it harder to grow a more wellness oriented product. Let's just say, for example, okay, the NIH studied, paid for by the government, a government grant, the NIH studied the benefits of turmeric on inflammation and then published those studies transparently. And then now you, as a company owner or business owner, or even a startup, you create a turmeric product. Now you don't have to pay for the study that was already done by NIH, right? And again, that's more of a verifiable study if you think about it that way, instead of a third party. So now you just use the NIH study to back your claim for your product. And so the gatekeeping can be allowing more people in the wellness space who want to seek natural remedies and alternatives and natural products to therefore have access to these studies that could be done. And the government should be studying all of this. That's what health is. That's what it's supposed to do, right? Or fucking delete it. Okay, delete the whole agency. Because if it's just a gatekeeper for one industry in particular, and allows this broken medical system to continue rampaging through America's population, and while we spend the most and have the least best outcome in the world, and our life expectancy is now going down, okay, that's a big major red flag. And so it's that right there that's going to blow up the wellness industry, because now there's not going to be, by the way, also, just a side note, these health agencies are also the go-to regulators. So if you own a wellness company today and you're selling a certain product right now, like bison liver or something like that, the RFK run HHS is not going to be as interested in regulating your natural food product because the priorities have changed. And this is very important because regulation and taxes are some of the biggest burdens on business owners and companies. So let's say somebody's trying to truly bring a great product to market, but then it's got to go through this heavy regulated system to even get to market. And then even worse, by the time your product, let's say, gets to market, it's been heavily regulated. So it's already reduced, let's say, the quality of the product. It's so fucking asinine and backwards that you would reduce the quality of your product, or let's say the particular milligrams of turmeric that you would put in the product, because the FDA comes in and says, no, you can't put too much in there because that might have an adverse effect. Again, maybe that's true, maybe that's not. Point is it's going to reduce the quality, and then you're going to go to market. It's not going to be nearly as effective. Or you're desperately trying to get FDA approval to go to market so that you can have that label that says FDA approved, because then that can get you into the larger grocery stores and the larger, food chains and things like that. So that's kind of another great thing I think that's going to explode in terms of the wellness industry. Yeah, and then Kennedy's vision includes strengthening the public health infrastructure, which could mean better integration and coordination between agencies like the CDC, FDA, and NIH. His approach might involve leveraging these agencies to better tackle public health emergencies, improve vaccine distribution systems, or enhance the response to health crisis with a focus on community health rather than just individual treatment. So it's a very key thing. He's talked about this a lot, but reorganizing these agencies and to help with hospitals and medical centers, really in general, to start addressing the root cause of illness and to be able to look at these as a broad scope instead of individuals where they're coming in, they're getting prescribed a particular pharmaceutical, and they're going out and they're taking that pharmaceutical for 6 to 9 weeks or 6 to 9 months until they eventually, go into surgery to replace this failed organ by any means. So again, improving the infrastructure will also enhance the idea that wellness-oriented products are going to be integrated into these community health centers. That's kind of what we want to see, right? We want to see big contracts buying from local great business owners maybe who offer a particular supplement or sell a particular supplement, or a small company even nationwide that sells supplements, to be allowed into these various health centers. So empowering health choices, pretty big here. His advocacy for informed consent in vaccine administration and broader health decisions could empower individuals with more information, allowing for personalized health decisions based on thorough, transparent data. This could lead to higher trust in public health recommendations when they are seen as collaborative and based on genuine evidence. So, very important to realize the informed consent piece. Informed consent is very important because you're essentially allowing the person to learn everything that they can about their illness and about the treatments that are available. Allowing this person to know that there are natural remedies that they should go to first will be able to filter the process of, I think, a lot of people continuing their disease and therefore getting surgery and just really end up dying of that same disease anyways. That's the problem right now with our medical system. And I laugh and balk, if you will, at people who still say that Medicare for all is something that's, something that you can do, something that you would want to do. I don't even know how that phone rang. Um, but I think that ultimately you have to think about it like these people are already ill and they're going through a process that's broken, but you want to give it to them for free. Medicare for all. This idea, this is a total lie. You want to take a broken system and then just give it away for free. So not only is it broken and people are not even getting effective outcomes, but you're also going to give it free. So it's also going to devalue, any economist would tell you, it would devalue that very same industry. So now it's going to allow people, because unfortunately, but fortunately, there's at least a financial incentive to companies and doctors and surgeons to perform a good surgery or to do the right thing in terms of their medical approach and to get a good result, right? There's at least some kind of lucrative incentive. If there's no lucrative incentive, it's all given away for free. Again, it's just totally devalues the product. So I think empowering people with information is important and letting them know the truth about particular products, the side effects, and being honest. Very good. Advocacy for environmental health. Given his background in environmental law, RFK Jr. could bring an ecological perspective to health policy, recognizing the link between environmental health and human health. This might involve policies to reduce exposure to pollutants, pesticides, and other toxins, fostering a healthy living environment for all Americans. So this is really addressing the Monsanto problem, the creeks, the flow, the problem in the Mississippi Delta, for example, that all the pesticides that go into the farms that then drain into the river, the Mississippi River, they go into that delta that is in the Gulf of America now, and there's a dead zone, by the way. So all of the chemicals that are poured out in that part of the ocean, there are very rarely any living fish and creatures that exist in that delta. That is pretty significant. So I think that addressing this issue will involve other wellness related companies and products and opportunities to come in and make a change and to do the right thing. So I think overall there's an exciting kind of journey, if you will, that everyone's going to be able to witness, everyone's going to be able to experience. And whether people are bitching about the fact that the guy was a drug addict and then he cleaned up his life and he had a redemption curve that then turned into one of the most powerful environmental lawyers, saved the Hudson River, like got companies to pay money to restore various environmental standards to all of these wonderful bodies of water and other ecosystems. Like, are you kidding me? Like, this guy is a remarkable human being. And to know his relatability to, of course, his uncle, John F. Kennedy Jr., and then Robert Kennedy as well, his father, they're both killed. I mean, doing whatever they do. And so I just think it's a remarkable thing that somebody like him is in charge of our health. I'm personally looking forward to it. You know me, I sell and offer supplements. I've been doing that for years. My dad's a chiropractor. The wellness industry is near and dear to my heart. So this is a really important time. And I do believe that if you are in the wellness space today with RFK Jr., this is why I'm started a sauna cold plunge business. If you're in the wellness industry today with RFK Jr. at the head of HHS, I believe there's a lot of prosperity coming your way, and there's going to be a flood of wellness products that can be introduced, I believe, into the medical system. Imagine if your hospital had a row of genuinely good supplements that people can start to take on or get onto supplement programs recommended by a doctor. Wow. Like that is the future of America's health. We need a great change. And imagine if we're all eating healthier meals. Imagine if seed oils were taken out of the environment and we were all put back onto a butter related diet. Like these are incredibly powerful ideas. Not that olive oil isn't so bad, that you can get some natural versions of that. But the point is we are on the precipice of a really massive expansion in the wellness industry. And if this is something that interests you, you should absolutely get involved in some way, shape, or form and recognize this growth. So I appreciate you guys tuning in. You guys have a great one. Peace.